everyone, my name is Serbi and I am part of the Medlearnity team. Today I wanted to do a brief and focused video on how to approach studying for both shelf exams as well as for Step 2 clinical skills. I'm going to share my screen with you. So I would like to start by talking about how to have an overall organization plan for your exam. And this is something that you'll do whether you're studying for Step 1, Step 2, or really any big exam of that sort. I like to have a plan from the beginning that kind of lays out my days for me. And this will obviously heavily depend on how many weeks you are or months you're planning to allocate for taking Step 2. And that will depend on whether you are done with rotations or have other commitments or not. But let us, for example, say that you're planning about 4 weeks of dedicated time to study for Step 2. What's important about this is not using the exact same template that I have, but getting the general principles from it. So you want to know your exam date and your study start date so that you know exactly how many days you have to dedicate to studying. It's also important to allocate days where you have other commitments, days where you plan to take time off as a break, and then days where you'll be taking practice exams because you'll most likely not be doing questions and reviewing topics as much that day, and then always taking the day before the exam off to mostly relax and to do a little bit of rapid review. Once you fill this out, you will know exactly how many days you have to allocate, and then if you have any buffer days, to put here a number of days remaining. You also want to allocate some days to any kind of practice test you plan to take, such as NBMEs or UWorld self-assessments and so on. You do not have to take an NBME as a baseline, but if you plan to, that would obviously go the day you're starting, the day before you're starting to study. Then once I know how many days I have to allocate to studying, you want to break it up into general topics. So for Step 2, that's going to be essentially your rotations: pediatrics, surgery, IM, family medicine, so on and so forth. And you'll allot those days here. And then you can actually allot the days off as well for your practice test, buffer days, and time off here. Then getting a little bit more into the nitty-gritty, you can actually have a calendar view. So this, for example, just happens to be May 2017. Let's say this was a month that you were studying. And here it's more big picture things still. So which days you plan to study what topics and which days you plan to take practice exams, half days off, buffer days. It just gives you a nice overview. And then to go even further into it, I like to actually schedule my weeks. And you can go as detailed or as not detailed as you would like in this, but I do think it's helpful to have at least generally a day-to-day schedule. So this is one example of a week, Monday through Sunday. And for example, from 8 a.m. to 12 p.m., I said that I would like to do either a PEDS UWorld block, a mixed UWorld block, an internal medicine UWorld block, and this will obviously be in sync with the calendar that you made and the days you allotted. But it's important to schedule out time for lunch, for general review, to go to the gym, go for a walk, eat dinner, some buffer time, your bedtime, and even little things if you plan to FaceTime a friend or have dinner with someone. It's important to put it in here so that you're making time for yourself. And this is mostly to make sure you get enough blocks, UWorld blocks done to finish all the UWorld questions, which I feel is the optimal question bank to use, which you can obviously use others to help as well. But you want to make sure you're able to get through all the questions in one question bank, and laying it out day by day is going to help you do that. Also, you can leave time for little notes here, whether make high-yield flashcards, bring your cardio binder if it's a cardio day. On the weekend, I used to study with a friend if possible. So note section can be helpful as well. So honestly, the point of all of this is essentially to just make sure you have some type of schedule with the big picture and then a more day-to-day schedule as well to stick to. So that's an overview of how I plan to study. Then if we talk about kind of general study skills and principles for Step 2 as well as the shelf exam. So for Step 2, what's important to remember is that Step 2 is different than Step 1. Step 1, you had to focus on a lot more of the nitty-gritty details the mechanism of action of different bugs or bacteria, things of that nature. That is still a little bit present in step 2, but it's much less present. Step 2 is more the big clinical picture. And for that reason, I do feel like it's, in a way, nicer to study for, because a lot of it will be relevant when you're practicing day to day, depending on what field you go into. So you have to make that shift mentally so that you're not so bogged up on memorizing all the tiny little details of pharmacology and microbiology as you did for step 1. And especially biochemistry, you do not have to know all the details of that either. Second, if you prep well for your shelf exams, you will have a strong foundation, and step 2 preparation will become much, much less stressful. And that is because your shelf exams the questions are going to be very similar to your step 2 exams, but more focused obviously on the rotation you're having. When you're prepping for your shelf exams, which in a way is also prepping for step 2, I would pick one resource for each rotation and try to get through the bulk of it by the end of the rotation. Which resource, it depends what you like. So I would talk to seniors or us, your tutors, to help you pick a resource for each shelf, but pick one in the beginning and stick to it. So some examples is I liked case files for neurology or BRS or pediatrics. And a lot of these you can find free PDFs online as well. The other thing is, like I said, step 2 is more clinical. So learn from your patients during your rotations and connect what you're learning with the patients to the textbook topics. You're going to remember the topics much better without having to just do rote memorization. And it's more applicable. Make high-yield sheets or flashcards, whichever you like, for each rotation and reuse them for step 2 CS and modify as needed. So for example, here I have a screenshot from some of the notes I took during my pediatrics rotation. I don't love flashcards. I like to write out high-yield topics in sections in notes, but some people like flashcards as well. I think either one is helpful. It just depends what you like better. And I used to break it up into kind of either very high-yield topics or topics that maybe weren't as high-yield, but I knew that I had to memorize so I could have quick reference. So for example, here I had some of the neurocutaneous disorders, immunodeficiencies, and these notes I took as I reviewed UWorld questions or as I reviewed whatever book or online resource that I was using. That's where I pulled the details from, mostly from practice questions, because practice questions have the most high yield information about subtopics in them. And then for both your shelf exam and your step 2 exam, start studying early and stick to a realistic schedule, but also a schedule that's both intentional and flexible. You want to leave time for buffer days. You want to schedule time in for wellness and breaks, but you want to make sure that you are allotting enough time to finish X amount of questions or X amount of topics by the end date, whether it be your shelf exam or your step 2 exam. Also, practice exam. Leave plenty of time to take practice exams and to actually review the practice exams and learn from them. The NBME questions, for example, are going to be very similar to the questions on the standardized exam that you take, so you can learn a lot from them. And then last but not least, trust the process. If you are studying in an organized way and working hard and getting through the material you need to get through, that's all you can do, aside from, of course, making sure while you're learning that you're establishing good study skills and good taking care of yourself and taking care of your mental health at the same time. If you're doing all of that, trust the process and try to remember that you're doing everything right, and hopefully it will, I'm confident, translate on your test day. So that is how I approach it in general. When it comes to one more thing I wanted to talk about was what resources to use. I think it depends on how you like to learn. If you're a visual learner, I really liked online MedEd. They're short videos on high-yield topics from everything from OBGYN to internal medicine. It's a free resource, and those are very nice videos to watch as you study for your shelf exam or if you're refreshing a certain topic for step 2. If you like to read textbooks kind of front to back, which you will not have time to do during step 2 for sure, but you might have time to read a lot of a textbook as you study for the shelf exam, which will stick in your mind when you're going to step 2. You can think about BRS is a good resource for that. If you like more learning from cases and bullet points, case files is a very good resource, especially for example neurology, and it's instead of rote memorization or reading a textbook, it's connected to cases. So it depends what kind of learner you are, and once you identify that, you can ask us for help, and we would love to help you identify resources. But overall, I hope this was a helpful video, and feel free to reach out for any clarification on these tips or any further questions.
Thank you for watching Medlearnity. If you found that helpful, please like our video, subscribe, and of course, ring the bell. And if you're really brave, be a hero and share some knowledge with a friend. Until next time.